Hi, welcome to another one of the Miami Corona Project Conversations. I'm really honored, particularly during what is becoming a critical time here in South Florida after this pandemic, to have one of our municipal mayors, to have the mayor of the city of Miami Lakes, Manny Cid, join us. Mayor Cid, thanks so much for participating. How are you doing? And how is your city these days?
We're doing well. We're doing well. All is going good. I mean, these are some very difficult times, right? I mean, it's the COVID-19 pandemic. You know, it's a novel virus, so we don't know. It's not like a hurricane, right? A hurricane, we know what to expect if it's a Cat 1, a Cat 2, Cat 3, you know, and so forth and so on. But you know, this has been a bit different, and we've had to be very resilient and kind of adapt on the fly. But yeah, otherwise we're doing well as a city.
You're the mayor, and you and your wife raised two kids there. You've been there for 27 years. You know, you were the youngest vice mayor elected. You clearly know that community inside out. How is the community itself? How are the neighbors of Miami Lakes? It's the north. Is it the northwesternmost municipality or not quite? It is, right?
It is.
Yeah, the northwesternmost municipality of Miami-Dade County. With how many residents do you have?
33,000 residents at the moment.
So it's a great community. It's Bob Graham's, right, our former U.S. senator and former governor's community. Just a beautiful, lovely municipality. Tell us how your residents are. I know we have a Baptist hospital there, or you know, like there's healthcare there. There's industry. There's restaurants. You know, it's got a beautiful town center. Tell us a little bit about how businesses and especially how families are dealing with this pandemic over the last few months.
Well, first, on the family side, I mean, as you can imagine, it's been very difficult. One thing that doesn't get enough dialogue, I think, in our society is what kids are going through. And I'm starting not only as a father, but I'm seeing it as a community. I mean, a lot of these kids are home. They've been home for the last 4 months. Summer camp. I'll give you a perfect example. We have 3 summer camps here in our community. But due to social distancing, I could only take up to 70 kids combined in all 3 centers. Where before,
before, what was it?
Yeah, before when all was going well at one of my sites, I would have 300, 400 kids. I mean, so you could only imagine the impact that it's having. And now all the anxiety with school, if it's virtual learning, if they have to show up in person with the mask on. So I can tell you, families are going through a tough time. You know, it's a major transition. I'll tell you this: mental health. There is a mental health crisis in our country. 50% of Americans have said that the COVID-19 pandemic has impacted their mental health. So you can only imagine. I'm starting to see it. We implemented something called Mental Health Thursdays in the town of Miami Lakes, where every single Thursday I bring in a mental health professional to speak to the community. We go live on Facebook, on Twitter, on Instagram, and YouTube, and have a conversation with the community. But I can tell you, as a town family, we're very tight knit. I literally know 5 or 6 families on every single block of this town. But it is going through a very difficult transition, and not only we're talking about also unemployment. So you can only imagine the stresses in the household if there's one breadwinner that can no longer work. I know a lot of folks got rehired, and we saw those numbers decrease in June. But one of the biggest things that I've seen is that the number of people now being permanently, although there's more folks getting rehired and the number overall of unemployment is going down, but the number of people permanently unemployed has been going up, and it went up in June. And that's having a major impact on the family nucleus, which we know that's the foundation of our society, right? So it is having a major impact here in my community.
I want to talk a little bit about the economy in a second, but before that, let's go back to Mental Health Thursdays. What kind of things have these online discussions generated? Like, to see there's some examples, some anecdotes, or just generally what's happening? What are people? What kind of emotional? Last night I was watching Cuomo talking about his own struggle with clinical depression. He was a COVID-19 patient, you know, the anchor at CNN. So he felt that, you know, as a symptom, as a cause of the actual infection. Clearly, there are mental health issues that those who do not have and that haven't been infected, they do not have the virus too. And I'm assuming that's most of what your Thursday, Mental Health Thursdays conversations were about. What do the mental health professionals tell you and tell your community on those Thursdays?
Well, there's a stigma, right? I mean, we're very open to talking about most issues, but when it comes to mental health, there's been this stigma that a lot of people don't want to open up about it. And so what we're telling people, and we've seen it work, that it's okay. It's okay to feel stressed. It's okay to feel the way that we're feeling because of the pandemic, but that we're here to help. And we've been able, through our professionals that have volunteered their time, we've been able to help out a lot of folks in our community who said, you know what, if the mayor's talking about this and he's saying it's okay to talk about it, and he's saying that it's, you know what, I think it's time for me to seek help. And we've seen several folks reach out and talk to some of the professionals and go through the process. But we know it's so important. But I think that's the main thing, breaking through that stigma. And that's why we've committed to talk about it every single Thursday. Sometimes it's an hour-long discussion. I mean, just talking about it, getting questions. One of the things too that I'm a big believer of is creating trust within our community. What better way to do that than having an open dialogue? So we tell our residents, hey, ask whatever question you want live. We'll read it off. We'll answer your question. And that's made a lot of folks very comfortable. And then they end up calling the professionals later on and having those more in-depth conversations.
What are some of the issues? What some examples of what? Obviously, not revealing any names or anything, but just what are some of the issues that come up from the community?
Well, I'll tell you, there's major anxiety and fear. I mean, the anxiety overall, nobody knows what's going on, what's going to happen with their job, what's going to happen with school, what's going to happen. So you have folks that are going through that. You can only imagine what's happening to them, because that has an impact not only on their mental health, their overall health. I mean, now you have folks that aren't sleeping, that are just going, you know, at that point, when you don't sleep, you don't get enough sleep, what happens? It's a domino effect. So you're starting to see anxiety at large levels. Look, another interesting stat that we talked about, 25% of Americans right now, because the COVID pandemic, are saying that they feel lonely, that they feel that they have no friends, that they're home, they're isolated. So that is something we're trying to reach out to those folks. We do, for our seniors, we're doing wellness calls. We reach out to them every day. We have a group of volunteers that calls them and just talks to them. But yeah, that is a major issue. Loneliness, isolation. We have, yes, the COVID-19 pandemic is the number one priority in our nation, but there is a mental health crisis ongoing right now also in our country.
Thank you for your leadership and your vision on that. I wasn't aware about that dimension of your leadership, and I just want to personally applaud you for it. As someone who was in the city's youth activities task force, someone who works with kids, and someone who's young, you're a young mayor, to speak so vocally and so eloquently about this, I do think sends the exact signal, the exact message that the community needs to hear. Absolutely, there is panic, there is fear, there's frustration, and all these things provoke mental health concerns, mental health issues, and there's nothing wrong with literally looking for help. And add to that the powder keg of these kids who can't go and release steam at your camps, and now they're in the home with a parent who's not just working from home or trying to find work from home, but also is now a teacher among a bunch of other, and a caretaker and all those things. So I thank you for that very empathetic spirit as a mayor. That's really, really important for people to hear. So the other thing you do as mayor, obviously, is to try to keep your town prosperous. I mean, you do that through your tax base. You do that by bringing in industry, jobs. So tell me a little bit about. And I'm going to go county and state later, but I just want to stay focused on Miami Lakes for now. But tell me how you think the pandemic. You can tell us about how it's impacted it now, because I think it's important to capture that. But with the anxiety that everyone feels about job versus no job, you as mayor, I'm sure, feel the anxiety of tax base, of businesses maybe not being able to sustain themselves. Tell me what what's on your mind, what keeps you up at night, and how you think, without knowing what's on the other side, how you navigate through this. What do you do as the mayor, as the leader of this community?
Look, on the policy side, when it comes to our budget, we're going to be okay. I mean, we've already done our forecast. This upcoming budget year that we're going into right now, we're actually going to be better off than we were in the past year, because we've added a lot of new value into our community. There's been several new developments, and so we're going to be okay. Last night, was a great night for our town. Banco Popular decided to build their headquarters here in our community. So
congratulations, Mayor.
thank
Congratulations.
you. So those, yeah, that's big. That was very big, and I think there's a lot of optimism. There's a lot of hope hopefully for the future. But what the things that do hurt, I mean, I'll give you a perfect example. There was a restaurant owner on last Wednesday who, when the county mayor made the decision to reclose dining rooms, that business owner pulled up in several vehicles, took everything out of the restaurant, gave the key back to the landlord, and drove off. I mean, this gentleman, it's a corporate restaurant, but they had invested. It was locally run, and they had invested, I mean, hundreds of thousands, if not $1 million. Just literally about 8-9 months ago, they opened up, and they walked away. And I think not only for them, but their employees, their managers, you know, and that scenario has already happened just in my town about 3 or 4 times. I mean, so that is in the last several weeks. So to me, that it hurts, because those are folks that aren't coming back. It's going to be very difficult to back, especially right now, to backfill. I mean, those spaces, those jobs, and it's that to me is very, very difficult, very sad to see. And I think when you see people's livelihoods just kind of disappear from one day to the next, it's a very difficult thing as a policymaker to see that.
But is there an understanding as to why it is that we need to put these restrictions? Are those accepted, or is there confusion, chaos, or dissent among that? I'm just wondering how that's playing out in Miami Lakes.
So in full disclosure, I own and operate a small restaurant. So this is I actually cook. The other day I was doing deliveries. So yeah, I'm highly involved. So I know the industry really well. I can tell you, in our town in general, I mean, our town council last night talked about it. I wasn't part of the discussion, obviously, because I own a restaurant, so I had to recuse myself from that point. But our town council is livid. A lot of our business owners, restaurants, because they feel that there wasn't sufficient data pointing to restaurants or gyms or any other use as being the cause for the spike in cases. And I think that's where you saw some dissent, where people were asking, hey, look, we should have more contact tracers to showcase where these cases are coming from. Then we make those decisions. But they really felt that it was that. And I'll give you another perfect example. Sergio's, the famous restaurant Sergio's here in our community, they were closed for 4 months during the pandemic. The last several weeks, they had rehired 25 people. They trained them on CDC guidelines, county guidelines. They reopened the Monday that Mayor Jimenez announced the closure of restaurants. So, I mean, they had already gotten everything ready. And that Monday, they had to tell their employees, hey, come Wednesday, we have to send you home. There's no more jobs. So I think that is the main thing. We definitely, as a community, we understand we've done our part. Everybody's done our part. The sacrifices that everybody in our society is making, I mean, it showed, especially during the first shutdown. But I think that there are a lot of folks that felt, hey, you know, if everybody was doing what they had to do in terms of, I can't speak for the entire county, but I could speak for my community, and everybody was doing what they had to do in terms of wearing their masks, social distancing. But I think some restaurants and a lot of the individuals in our community, residents, were a bit confused as to why that happened. And I think the data from the contact tracers just wasn't there. And we're hearing, discussions all over the place when it comes to that. So, but yeah, we are talking to residents.
This morning's health department tells us that as of yesterday, and I'm just reading off their website, the same one you see every day, 1,175 deaths so far in Miami-Dade County. There were 32 yesterday, 4,443 hospitalizations, 69,126 positive residents. And as you know, we are now the global epicenter of this pandemic with the positivity rates. I saw Carlos Migoya on TV this morning talking about what's happening at the hospital. So there is this dire need. We are today on July the 15th in a really, really precarious situation. And everything you talked about, economic hardship, mental health hardship, but there's also lives, about saving lives. And I just know that there is a certain amount of frustration out there. Do you clearly the there were CDC guidelines on how cities open up, but there's also measures that were placed. The numbers are up. Do you attribute that? I mean, the numbers are up just objectively. There's more infections, there's more deaths, there's more hospitalizations. What do you attribute to that? There's other places, not in the US, but, across, the pond in Europe that have flattened their curves. Here in Miami, I was very, very proud of our community. I mean, we looked good. We looked good a few weeks ago, I don't know if you know this about me, but I sort of keep a record that I do. So we had 1,000 deaths on July 1st. That was our 1,000th death. So that was, just 15 days ago. Since then, 175 have died. But every day I just sort of keep a record of the deaths and what's happening. But, earlier on, we were keeping pretty good. Schools had shut. We had shelter in place. Beaches were closed. And then something, happened where we were supposed to go back into the community, but still keep our distance, wear a mask, and doing all that. But do you think that the community just got so frustrated that some of them didn't apply? I mean, what do you think the cause of this peak is, this increase? What do you think is going on?
No, so first, and going back to empathy, I think it's really important to always focus on our first responders, the nurses, the doctors, the hospital staff specifically. I mean, people in our community that are in the hospital right now, that are intubated, that are on ventilators. I mean, we have to make sure that not only prayers, but we have to do everything possible to help them and to make sure that the staff there is equipped as much as possible. And we have to, I mean, it's a really sad situation. So,
we're at 200 intubations today, and there's an alarmingly large number of those that don't make it. And it's just so painful for those families who can't say goodbye, for those people who were healthy, 2 weeks ago, and now are intubated and may not go. So that sense of empathy is important. It's also, I think, a sense for alarm. My God, that could be me if I don't social distance. I could be giving it to my grandmother, to my son, so those are things.
And I think that's what possibly happened, right? That we as human beings, human nature is, especially here in Miami, folks love to get together. I mean, there were major house parties. There were, I mean, you name it, the amount of events, things happening in our community, people that really started getting comfortable with what's going on. And the reality is there wasn't a good job being done when it came to enforcing the guidelines. If we would have enforced the guidelines from the entire time, I think it would have been a different story. And here's one of the things that frustrates me. The county, Miami-Dade County, has $475 million from the CARES Act. Cities are supposed to get half of that. And we would be able to use that to enforce, to educate. And those dollars haven't gone down to cities yet. I know that there's an ongoing discussion, as everything in Miami-Dade. I mean, things take a long time, but that's where I feel that there was a major fail overall, that there should have been more enforcement. I mean, for goodness sake, I mean, there were almost nightclubs, there were nightclubs ongoing in certain areas of our county. I saw a video of people partying it up like there was no tomorrow. And that's why at the beginning of this peak, you saw that most of the cases were young people. But what happens is, and you hit it on the head, those young people then go home and they go hang out with their abuela, le dan un beso a la abuela o al abuelo y un abrazo. They give them a hug, and what happens is that's the major issue, and that's what we started seeing. But the data was there because you saw at the beginning of this peak, the majority of folks that were getting it were young people. But now at this stage, it's the older, the most vulnerable right now are the ones getting it. But because of that, but there were restaurants and nightclubs. I mean, literally, you could see videos everywhere, folks partying, and there was not a good job of enforcement. Here in my community, in the town of Miami Lakes, I mean, we're 33,000, so it's not, city of Miami's 400,000, so you can only imagine it's a bit more difficult to police that. But we did a good job. I mean, we were on top of that since the beginning of the pandemic. Since March, we've had, I believe, 250 cases here in the town of Miami Lakes, and we've been very diligent. I mean, every time our police is out there, code enforcement, we're talking to folks, we're educating them. But I do think it's human nature, right? You saw there was a while there, and I don't know if you remember this phase. There was almost a 2-week period where nobody was talking about COVID, right? COVID was kind of like the cases had gone down. the curve got flat, and I think it was human nature. Some folks got really comfortable. But yeah, the data is there showing that the majority of this wave at the beginning was young people, but then they go home. They got to go home. They got to go see their loved ones, and that's where the issue was happening.
So what recommendations do you have to improve the situation at this moment? Like where we're standing today, we're mid-July. Like what do you suggest that the schools, the city, your city, the county, government, the state, federal, like what would you, as a father, as a neighbor, and as a mayor, what do you think we should be doing to move forward?
Look, one of the most,
and of course, I'm not suggesting that the science. I mean, you can access the science too about how things get spread and all that. But just as a policymaker, as a leader, what recommendations do you have to improve the situation?
The toughest part of being a policymaker today is that the science changes every day. I mean, this is a novel virus. I'll never forget at the beginning, there was issues with, just contacting, if you touch a table and somebody touched it, and then that data started changing. And then there was data on asymptomatic. People that are asymptomatic could be super spreaders. And then there was other information that came out. So one of the toughest things of being a policymaker today is that the information changes every single day, even for the epidemiologists, even for the infectious disease experts. The information that they're getting changes every day. So I understand the tough position that Mayor Jimenez is in, because the info that he's getting, which I'm not getting, and the vast majority of the public isn't getting every day, it is ever changing, right? So I think it is very difficult. But immediately I would release those dollars to cities and begin the real enforcement of all the rules, and work with the Florida Health Department and the County Health Department to help our hospitals immediately. The money's there, and that's the one thing to me that is a bit frustrating. The money has been sitting there. The funds to help our community has been sitting there on the county side for a while now. I mean, the federal government passed the CARES Act a while back, and the money's been there for quite some time. So I would release those funds immediately. Work with our hospital system. Keep working with the Florida Health Department. I know there's conversations today about bringing in another 1,000 nurses from the state. So I would immediately get on the phone and start working with everybody. What you're seeing right now is everybo's fighting with each other. I mean, you saw what happened yesterday with the Mayor Hialeah, the Mayor of the county, and everybody's kind of. And I think this is a time for unity, and I think we have to get together. I mean, we will get through this, but it's a time that we have to get together and get past this. But I would immediately release those funds to municipalities. Enforce the rules today, because closures here and there, I mean, they might work temporarily, but until there's a vaccine, that's not really the case overall. So I think it's just a really tough spot to be in, because the information does change very often.
I know your time's limited, Mayor, so I just want to ask you two last questions. One, just on a broad scale, not COVID-19. As you know, there will be future pandemics. A lot of this is obviously caused by human interaction with nature, whether you're deforesting a forest that had wild animals that never came into contact with humans, those stressed animals being brought to wet markets, people being in contact with animals that are in contact with other animals that would have been from two jungles, two forests, now in small cages, and then humans get on airplanes. So because of deforestation, because of pollution in the atmospheres, that makes us more susceptible to diseases, because we live in a world where we're changing our climate, and because it's getting warmer, which means that those mosquitoes that could not deliver viruses from the tropics now find their way into Miami and will in the decades to come. Because of those reasons, this is not the last pandemic, unfortunately, that we're going to suffer. We've seen just since the millennium a series of pandemics, impact us in society, from Ebola to SARS. So, knowing what you know today, based on our national supply chain, how we address this pandemic, what local communities did, the vulnerabilities that some citizens had versus others, what happens to people's incomes, knowing that this is not the last pandemic, are there some lessons that you think we can learn so that when we come out of this on the other side, and I hear you, I think a vaccine is how we come out of this. I don't see another way how we come out of this thing. So it's still still a little bit in the future. And we're learning as we go. You said it. I think that was very wise of you to understand the fact that it's a new virus. So I was just speaking to a professor at the medical school here at the University of Miami before having this conversation with you, and she's explaining that these are viruses that change, and you learn about the virus. We first thought it just affected the lungs. Now we understand it affects multiple systems. At first, we weren't even talking about particles in the air. Now we are exploring that. When we first started this thing back in mid-March, it was about washing your hands, about wearing a mask. So, get new information, you get new data, and you go with it. We're rolling with a new virus. There is no playbook. So we're still writing the playbook, but the lessons that we've learned to date in writing that playbook, are there some that you have gathered that you think we should use as we build system, society, infrastructure, healthcare systems, whatever, or that will help us prepare for the future pandemic that will inevitably come?
Look, I think we've been fortunate overall as a country that it's never gotten to this point, right? Even the other viruses that you've spoken about, it's never gotten to the point that COVID has gotten to, right? So at the end of the day, people probably thought, hey, this is gonna go by the wayside like every other virus. But I can tell you, one of the first things that should happen is and it didn't happen enough, right, was the initial shutdown of flights from certain countries where this was happening, working with folks. But I mean, I think even at the peak of the pandemic, Americans were going, and people were coming from countries where this was a hot spot. I mean, so it was inevitable, especially in Miami. I mean, Miami International Airport, the amount of flights that come in from everywhere. But I think there has to be a more robust discussion there at the front end, right? That's obviously the front end. But once that pandemic comes, yeah, there's major lessons specifically to our healthcare system on the resiliency side. I mean, and it's interesting because now we've had such a robust discussion on climate change and being resilient, and on hurricanes, being resilient. For example, I've changed the code here in Miami Lakes to allow for metal roofs, for eco roofs, to be more resilient, to allow. So I think you're going to see cities, counties changing their laws if not now, right after this, to be more resilient for pandemics, because we've never planned, really, local governments have never planned for a pandemic. And we planned for hurricanes, we planned for sea level rise that's being talked about, and the impact that's even here in Miami Lakes has had on our drainage system. We could plan for that, but we've never had a robust discussion on pandemic. Nobody, if I would have brought this up a year ago in our strategic retreat, hey guys, we need to add, the planning for a pandemic into I think I would have been laughed at. But now I think you're going to see in every municipality, in every hospital, everywhere, every strategic plan, there will be funds, there will be discussions surrounding pandemics. I can tell you, we will have that in our strategic plan going forward, because it's changed the way that we do business here in the town, and we deliver services for our residents. But yeah, that discussion is ongoing. But yeah, think about it. Just a year ago, we would have brought this up. Hey, we need a plan for a pandemic here in Miami. You and I would have got laughed at by everybody. Say, what are you? This is not going to happen.
I love your conversation about sea level rise. Miami is ground zero for sea level rise, as you know. You are the farthest municipality from the water. You're the northernmost and westernmost. You're also very close to, you're the farthest from our first coastline, the Atlantic Ocean. You're the closest to our second coastline, the Everglades, and you're also right above our third coastline, which is what you're talking about, your water table, the aquifer beneath your feet. So basically, yes, being able to play three-dimensional chess, to see out into the future and to understand how you don't have to be Key Biscayne or Miami Beach to worry about sea level rise, that Miami Lakes can worry about sea level rise, is the same thing that this pandemic is showing us, that yes, there are ways of, because we're all interconnected, because the world, as big as it is, has gotten smaller, and because so much of it is changing due to human-made changes to our climate, that we need to be proactive in responding. So I do see that, and I'm hopeful that not just Miami Lakes, but all our other municipalities here in Miami-Dade County will enact policies and plans to prepare for what is inevitable: hotter summers, more pandemics in the decades to come. Hey, to end, and I know I've taken a lot more time than you promised me, so I'll just end with this question.
That's all right.
Which is,
I'm really enjoying the conversation.
well, thanks. Me too. You know, that's why these are conversations. It's not a gotcha interview. It's literally, I want to learn from you, and I want to share that. And I also, I mean, the reason I'm doing this too, Mayor, is because I'm trying to document this moment in time. This is part of a University of Miami project where I'm trying to capture the voices. And part of what this does is this goes into the website, and then we invite the community to listen to scientists and leaders and cultural leaders, political leaders, business leaders. And then we invite the community to tell us their own story. It's for them to share their voices too. So it's a way of, in real time, capturing the collective voices through this pandemic, because I don't want us to forget this when we come out on the other side. I want us to understand that there's a guy who went to Miami Lakes, he opened the door, took all his stuff out, gave the key back to the landlord, and lost, several $100,000 and a bunch of employees, and that's not coming back. And cultural institutions will suffer that same fate, and people will bury family members without being able to say goodbye. So I don't want us to forget this moment, and that's part of what this recording is. But I don't want to end it this way. I want to end it on a hopeful note. So I just want to have this very youthful mayor who can very eloquently talk about mental health and how we all have to take care of ourselves, to just share a message of hope to your residents. As you talk to me about a lot of the anxiety that the members of Miami Lakes, well, Miami-Dade County, all of the world actually are facing, but speak to your residents about how you believe that they will get through this. Just a hopeful message to end our conversation.
Look, I'm extremely optimistic that we will get through this. What I've seen overall from our residents, from folks in our community, is people coming together every single day. I mean, we went from a city that was providing core municipal services to providing social services, not only from the mental health side, but every day we were delivering food to seniors, to homebound seniors. I mean, we were doing food distribution. We have another one tomorrow. And these events are run by folks who themselves were furloughed, or they were outright fired and they were permanently laid off. I mean, so I'm extremely hopeful and optimistic, because I've seen people come together like never before. I mean, standing shoulder, Republicans, Democrats, Independents, standing shoulder to shoulder, working together. And we need more of that as a society. I mean, there's way too much. I mean, you turn on any news station and you see it, but I think cities like ours are a perfect example of how people can work together to get past through, to surpass this pandemic, because we will get past this. But yeah, that resiliency that you have shown as residents here in the town of Miami Lakes is something that I'm extremely proud of you all. And to me, it's what energizes me every single day when I wake up, because if you can do it, if dozens of people have volunteered and you've been furloughed or you've been permanently fired, and you wake up every day thinking about other people, that is extremely powerful. I mean, that in itself is one of the most powerful forces that I've seen in recent history in this country and really in our community. So we will get through this, and united, I mean, we are better for it. So just want to thank all of our residents for working together and seeing past our petty differences sometimes. There are, because they are petty differences. And I think what this pandemic has taught us is that we're more alike than anything else. I mean, too many times we focus on what divides us than what brings us together. So I do just want to thank all my residents for coming together and really showing me the way and showing everyone else the way. So thank you. Thank you, Mayor, for your leadership, and thanks for taking time with me in this conversation. I so appreciate it. Thank you, Xavier. Really appreciate it. And I love the conversation style. It's greatly appreciated, especially in these times. Right? Yeah. Stay safe and healthy, Mayor. Take care. You too.